Hi, my name is Melissa, and my presentation is on restraints. The objectives of this presentation is to discuss some different types of restraints, what type of patient you should use restraints on, and how to apply the restraints. For the disclaimer, protocols may vary, and be sure to use your agency's protocols when and how to use the restraints. Today I will be using the restraints and protocols that I use on the agency that I work for. Basic seatbelts on an EMS cot. Seatbelts are designed to keep patients safe when riding in the ambulance. This is very true even when you're riding in your personal vehicle. You should always be belted. Same goes for in the ambulance. Seatbelts should be applied to every patient that is being transported. So no matter what the complaint is, they should be belted in for their safety. And it shouldn't matter the age of the patient, from very little to very old, they all should be belted in. The seatbelts that we're going to discuss is a harness style with a total of 5 different belts on the cot. Here is an example of the EMS cot that I use. As you can see, the 5 different belts are on the cot. And here's an arrow that's just pointing to one of those belts. And here is another picture of just a seatbelt, just like we're all used to. One side goes into the other and it locks in. Here's a picture of somebody who is on the cot. As you can see, the 5 different seatbelts that are over her, 2 over her shoulder, 1 over her waist, and 2 over her legs. The next restraint we'll be talking about is called buckle guards. Buckle guards are a metal or a plastic brace that goes over the seatbelt buckle. These are very easy to use and very quick to place as well. Buckle guards are used in patients that are trying to get out of the seatbelt or that are trying to unbuckle themselves. So any regular patient would not be able to get the buckle guards off. They're very deceiving on how they go on and go off. So really anybody from like an elderly patient who is just fidgeting and just trying to get that buckle off as hard as they can, to maybe a child who just doesn't want to sit still and knows how to get out of those seatbelts, a buckle guard would be appropriate to use. Again, these devices are very easy to use. You just place the buckle guard between the buckle when you fasten it. Here is an example of the buckle guards. We have on the agency, on the ambulances that I work for, we have 2 buckle guards per ambulance. And the placement can vary to where you deem fit that these go. And this is how the buckle guard is used. You place one end inside the metal piece and the other end clicks into it just like you would normally click into a seatbelt. And then it's locked in. The patient is unable to pull it apart. They're unable to get to the release button. If you notice the slit in the middle of the guard, that is where you can either put your scissors or another device to press down on the red unlocking mechanism and unlock that, and it'll come right off. So it's very quick to place. It's very quick to take off. As you can see, the buckle guards are placed. They're relatively easy to place. They're very secured on her, as you see it right there. Again, depending on the issue that you are dealing with, you may want to place them in different spots. The next restraint that we will talk about is our soft restraints. Soft restraint is a device that is a padded cuff. It goes around the wrists and ankles of your patient. I believe about every agency has either a soft restraint or like a handcuff type restraint. The service that I work for, we only have soft restraints for these type of restraints. And this is what we choose to use. Patients that need to be in soft restraints are the patients that are aggressive and or potentially that are on a hold, making sure you're always using your protocols when you're using your restraints. The protocol that I have to use is they're either aggressive with us or they are placed on a hold. To fasten the restraints to the metal frame is the most appropriate way to do that. There is 2 ends to the restraint, so the one goes to the frame, the other one attaches to the patient's wrist or ankles. Determining on what you're dealing with is determining how you would proceed with this. Here is a picture of the restraints. As you can see, there's 2 blue ones, which are for the wrists, and 2 red ones, which are for the ankles. You can see there's enough slack so you could put these restraints anywhere. The agency I worked with, they are not mandatory to be on the EMS cot at all times. So if we do get called to an aggressive patient, we will put them on prior to going and seeing that patient. And here is a picture just showing you that the restraint is attached to the metal frame. That is very important to make sure that that is on the frame and not on any other moving part of the cot. And as you can see, that little metal piece locks onto the restraint. So then, therefore, after that is done, you cannot move that unless you take the key to unlock it. And then you can move it as you wish to. Here is a picture of the restraints being on the ankles. So this is, they're very secure. She can't lift her leg up. As you notice, the seatbelts are on as well. So you do the restraints as well as the seatbelts to make sure that patient is secured. And here is just a photo of the wrist. The agency I work for, we typically put one wrist up by their head and then another wrist down by their waist. So this is just showing the way that we do it, remembering to check your protocols or do it the way that your agency wants you to do that. And here is just a full side view of the 4 different restraints on the 4 limbs. Again, she is still buckled with the 5 seatbelts, and then she does have the 4 limb restraints on as well. They're all very secured. They are secured to the metal frame of the cot, and then to her ankles. They are locked in by her ankles and wrists, as well as locked in to the brace or the metal part of that cot. In this presentation, we have seen different types of restraints, who we use the restraints on, and how they are applied.